so much, Dawn, for the introduction, and good afternoon to everyone. As Dawn shared, my name is Elise Balzer, and I do work in the National Immunization Program at the Indian Health Service. One quick caveat before I jump into our learning objectives. I am not a clinician. I am a public health practitioner, and the information that I review today are published public health recommendations. If you have any clinical questions and you are clinical staff, please go ahead and talk with your medical director or equivalent to talk about that clinical guidance. And if you are a patient, please go ahead and talk with your doctor or other trusted healthcare provider about your clinical questions. Our learning objectives for today are to go ahead and review the current information about the flu and the flu vaccine. The second thing we'll do is discuss the increased risk that individuals with chronic health conditions face with flu infection. And thirdly, we'll identify some strategies for messaging and promoting influenza vaccination with COVID-19 vaccine, and for some people, vaccination against RSV. So what is the headline up front? What you're going to hear me talk about, a few of the themes that you're going to hear me talk about, are that younger children, pregnant people, and older people are at higher risk of complications from the flu. And for these folks, starting vaccination as soon as vaccine supply is available isn't going to be important. And for everyone else, vaccination by the end of October to protect these high-risk groups is going to be important. It is my understanding that today's audience includes a variety of people, from community leaders and non-clinicians, as well as seasoned medical professionals. And so throughout the presentation, I'm going to be introducing a few terms, just so that we are using a shared language. And so just to start, I wanted to start with these three, and I'd also invite our more seasoned vaccinators to go ahead and chime in the chat if you have anything else to add to these definitions. The first thing we'll talk about is flu season. So when I say flu season, what do I mean? For disease surveillance purposes, IHS considers October 1st the start of flu season. And then on top of that, there's also the immunization or the vaccination flu season. This starts as soon as vaccine supply is available, which is typically late July or early August. And then new this year, you're going to hear me talk about respiratory disease season. And this is to consider all of the vaccines that are available to protect against respiratory diseases, including influenza, COVID, and for some people, RSV. And again, thinking a little bit further about definitions, what do I say when I mean flu? First of all, it is not just a cold. Influenza is a potentially serious disease that can lead to hospitalization and sometimes even death. And for some people, getting sick with the flu can mean just a few days of feeling bad and missing work, or it can mean more serious complications, such as bacterial pneumonia, ear infections, sinus infections, and worsening of chronic medical conditions. Over the next few slides, we'll talk about the past few flu seasons, but what you need to know is that every flu season is different, and that depending on the type of flu virus circulating, flu can affect people differently. What we typically see during flu seasons is that millions of people get flu every year. They get infected with flu every year. We see hundreds of thousands of people hospitalized, and tens of thousands of people die from flu-related causes. During the past flu season, it was a very tough flu season. We lost a total of 166 children to influenza-associated pediatric deaths. And during the 2021 and 2022 flu season, 65% of children ages 0 to 17-year-olds who were hospitalized had at least one underlying health condition. So in a few slides, in a few minutes, as we start talking about underlying health conditions, please do keep in mind that it can very adversely impact people's well-being. There is more information about these statistics on CDC's Flu View. Switching to looking at IHS's data, this is the summary of influenza-like illness for the previous flu season. The percent of ILI visits or influenza-like visits is on the left side of your screen, which is divided by the total number of daily outpatient visits at IHS facilities. The horizontal line that you'll see in the middle, the bottom middle, is the 2022-2023 baseline value. And so what we're looking at is what we're looking at here is the amount of disease that we're seeing compared to our baseline value. And this baseline value is provided by a definition per CDC. What's striking to me about the 2022-2023 flu season, which is in blue, is how early the flu season started, how early we started seeing influenza-like illness compared to the previous flu seasons, in particular those seasons that you'll see in green, pink, and orange, which were the flu seasons prior to the pandemic. Also, what struck me about the 2022-2023 season is that we did not see a secondary peak like we have for previous flu seasons. And this was interesting just in that the disease that we started to see in the community started earlier, and it rose more quickly compared to some of the other flu seasons, and then dropped off more quickly, again, compared to previous flu seasons. Our IHS vaccination trends for the 2022-2023 season, we administered 215,667 doses of influenza vaccine, which covers about 31.8% of the active clinical population eligible to receive influenza vaccine. And just as a note, our goal is related to the Healthy People 2030 goal is 70% of the population covered. So now let's go ahead and transition to talking about our upcoming flu vaccine season changes. Throughout this next section, you're going to hear me talk about the ACIP. This is the Advisory Committee on Immunization Practices to the Centers for Disease Control and Prevention. This group, the ACIP or ACIP, is made up of immunization experts from across the country, and they are charged with making the vaccine schedule recommendations to the director of the CDC, and then the CDC director accepts or denies the recommendations. So again, new for the upcoming flu season, vaccine guidance for people with egg allergies. So this is good news for those folks. So the new recommendation change is that all persons ages 6 months and older with an egg allergy should receive any influenza vaccine, either egg-based or non-egg-based, that is otherwise appropriate for the person's age and health status. And so what this means is that additional safety measures are no longer recommended for flu vaccination beyond those recommendations for receipt of any other vaccines. I did provide a link to resources for vaccine safety and checklists on immunize.org for your own consumption later. So why was this recommended change made? So the ACIP voted and the CDC director accepted the recommendation, which now brings the guidance into alignment with AAAI, ACAAI, and AAP. I did provide the ACIP PowerPoint presentation that walks through the reasons for the recommendation change. And again, I think this is excellent news for folks with egg allergies. Now let's move into discussing the 2023-2024 vaccine recommendations. And I have to say, I love our flu vaccine recommendations. They are so straightforward compared to so many other vaccines. So unchanged from previous year's recommendation, everyone 6 months of age and older is recommended to get a flu vaccine. Similar to other past flu seasons, some children will need 2 doses separated by 4 weeks. And those children are age 6 months through 8 years of age who have received fewer than 2 seasonal vaccines before July 1, 2023, or for whom vaccine history is unknown. Go ahead and administer that first dose as soon as the supply becomes available for these children, and then go ahead and administer the second dose, even if the child turns 9 between the receipt of dose 1 and dose 2. For all other children, just 1 dose of influenza vaccine is recommended. So those children 6 months through 8 years of age who have received at least 2 doses of seasonal influenza vaccine before July 1st, 2023, just need 1 dose. And children 9 years of age and older also just need 1 dose. New last flu season, so previous flu season and still in place this season, is that the ACIP made a preferential recommendation for older adults to receive high dose and adjuvanted flu vaccines. This is interesting to me because ACIP does not typically make preferential recommendations for one product over the other, but in this case they did. So those products include the Fluzone high dose quadrivalent vaccine, Flu Block quadrivalent recombinant flu vaccine, and Fluad quadrivalent adjuvanted flu vaccine. And I did include another resource for vaccinating people 65 years and older for you. One consideration is that if none of the preferentially recommended vaccines is available at the time of administration, please go ahead and administer any other age-appropriate flu vaccine instead. So the reason for this is if you have the patient in front of you and they are willing to accept a flu vaccine, we want to go ahead and get them protected as soon as possible. So vaccinating with the vaccine product that you have on hand is appropriate in this case. ACIP made this preferential recommendation based on review of available studies, which suggests that in this age group, these vaccines are potentially more effective than standard dose unadjuvanted vaccines. And I did link to the ACIP recommendation framework slides just for your own knowledge if you are interested. And I will say, I get the question. So is there a preferential product for other age groups? And the answer is no. So there is no preferential product for those folks who are younger than 65 years of age. Let's go ahead and talk for a few minutes about who should not get a flu vaccine. So babies who are younger than 6 months old are too young to receive a flu vaccines. As we'll talk about in a few slides, these youngest babies have the highest hospitalization and mortality rate. And so that's why it's so important to vaccinate pregnant people to protect the fetus and baby in their first few months of life. And then other folks who should not get a flu vaccine include people with severe life-threatening allergies to any ingredient in the flu vaccine. So this might include the gelatin, antibiotics, or other ingredients. People who should talk to their healthcare provider before getting a vaccine include some people with a history of Guillain-Barré syndrome should not get a flu vaccine. And some people who have had a severe allergic reaction, such as we talked about on the previous slide, to a specific vaccine product should get a different product if that is available. Product-specific clinical guidance is outlined on CDC's website and linked here. And let's talk for a few more minutes about guidance for timing of vaccination. So for everyone in general, vaccination should be offered ideally by the end of October. The exceptions are that children should be vaccinated as soon as vaccine product is available, as soon as the supply is available. Another exception is pregnant persons in the 3rd trimester can be vaccinated as soon as vaccine supply is available. For adults, and especially those over 65 years of age and older, and pregnant people in their 1st or 2nd trimester, July and August should be avoided unless there is a concern that later vaccination might not be possible. So you know your patients best. If you know that for whatever reason, they are not going to be able to come back in the September-October timeframe, then go ahead and vaccinate those adults in the July and August. Otherwise, the September and October timeframe is preferred. And just a friendly reminder that vaccination should continue throughout the flu season if influenza viruses are circulating and unexpired vaccine is available. And thinking about those babies who are 0 to 6 months of age and then age into that 6-month and older cohort during the flu season, making sure that you have a vaccine available to them is really key to ensuring that they are protected against flu viruses. Vaccine co-administration. So as I promised, before I go into talking about a new idea or concept, that I would define it first. So to do that, I will share that co-administration is a common practice where a patient receives more than one vaccine at a visit at a time. This helps people to stay up to date on their vaccines. So the ACIP does recommend that flu and COVID-19 can be co-administered. And they do state that it is acceptable to administer RSV and other vaccines at the same time, but I do encourage you to review the co-administration in the RSV recommendations before having that conversation with your patients to ensure that shared clinical decision-making is appropriate for administering RSV as well as administering RSV and flu at the same time. And then friendly reminder when co-administering more than one vaccine at the same clinical visit to go ahead and separate the injection sites by at least 1 inch if possible. And then to consider administering vaccines that are associated with an enhanced local reaction in separate limbs. So for example, we know that for some patients, administering TD can cause redness and soreness. And so vaccinating on separate limbs for TD and flu would be appropriate. So now we are going to transition to talking about risk factors and health disparities as they relate to flu. Over the next few slides, we'll go over some of the diseases that disproportionately impact American Indians and Alaska Natives, and then we'll walk through the list of risk factors that can impact someone's susceptibility to complications from the flu. And you'll notice that many of the risk factors that I'll talk about are also the diseases that can cause complications from the flu, and that also disproportionately impact American Indians and Alaska Native patients. And as I promised at the beginning, I want to go ahead and define so that we are using shared language and understanding together. So the definition of a health disparity are the differences in incidence, prevalence, and mortality of a disease and the groups and the related adverse health conditions that exist among specific population groups. Health disparities are one reason why certain diseases take a greater toll in one population over another. So the first disease that I wanted to talk about is HIV. So as of 2018, which is the year from which we have the most recent data, in the United States, among adults and adolescent American Indian and Alaska Native males, the rate of HIV was greater than the HIV rates for white males. And the rate was also greater for American Indian and Alaska Native females than compared to white females. In 2018, American Indian and Alaskan Natives had the highest rates of hepatitis C related deaths among all race and ethnicity groups at 9.05 deaths per 100,000. And I did include the source at the bottom of this slide for you. The next few diseases are cardiovascular disease, which is the leading cause of death among American Indians and Alaska Natives. Coronary heart disease prevalence rates are higher than 12% among American Indians and Alaska Natives and are believed to be underreported by 21%. With stroke, and then finally stroke is the 6th leading cause of death for American Indians and Alaska Natives. And again, you are the experts in your community, you know your patients, and you are able to put names and faces to the statistics that I'm sharing. And the purpose of reviewing these health disparities is within the context of how flu vaccine can complicate these risk factors. So let's go ahead and talk through some of the factors known to increase flu complications. So adults ages 65 years and older And why is this? So the immune system weakens as you age, and secondary infections such as pneumonia can become common. And older adults are also more likely to have other health conditions like diabetes that increase their risk for complications from the flu. And we've talked about this a little bit, but children are at higher risk of complications from the flu. All children younger than 5 years of age all children younger than 5 years are considered at higher risk of serious flu complications. The highest risk is for those younger than 2 years old, and the highest hospitalization death rates are among infants younger than 6 months old. And again, I know I said this earlier, but that is why it is important to go ahead and vaccinate pregnant people so they can go ahead and pass along protection to their fetus and baby once they're born for the first few months of life. Other risk factors include neurologic and neurodevelopment conditions, blood disorders, chronic lung diseases, endocrine disorders, heart disease, kidney diseases, and liver diseases, as well as metabolic disorders, people who are obese, people younger than 19 years old on long-term aspirin, people with a weakened immune system, and people who have had a stroke. So again, if you think about those adverse diseases that we talked about on the previous few slides, and think about how they can be impacted by flu, we really see that American Indians and Alaskan Native are at higher risk if they have higher risk factors. Other people at higher risk from the flu include pregnant people and people 2 weeks after the end of pregnancy, people who live in nursing homes and other long-term care facilities. And one other important group to go ahead and vaccinate, but are not necessarily at higher risk from flu complications themselves, are household contacts of people who are at higher risk from flu. This is especially true for pregnant people and those newborn babies that we talked about a few minutes ago. Other people at higher risk for complications from the flu, people from certain racial and ethnic and minority groups are at increased risk for hospitalization with the flu, including non-Hispanic Black persons, Hispanic or Latino persons, and American Indian or Alaskan Native persons. And the causes are from races, both structural and interpersonal, which are fundamental causes of health inequities and health disparities in disease. The impact of these inequities on the health of Americans is severe, far-reaching, and unacceptable. And these health disparities underscore the urgent need to address systematic racism as a root cause of racial and ethnic health inequities and a core element of our public health efforts. I did include more resources from CDC's Minority Health page on health disparities and some of the causes. And so now I'd like to go ahead and shift a little bit. I'd like to go ahead and shift to talking about respiratory disease season communication. And this fall, we have a great opportunity to increase the trust in vaccines by building vaccine confidence and reduce health disparities for American Indian and Alaskan Native populations. That's because we have our routine flu campaign that you are probably quite accustomed to. We have the COVID-19 vaccine fall vaccination and transition to what's called commercialization. And we also have the implementation of the RSV vaccines for some older people and monoclonal antibodies for infants and babies. And the challenge that you might experience is that some of the vaccine supply for each product may be available at different times this fall. And so I mentioned on the last slide about building vaccine confidence. And so what do I mean by that? What does that mean? Vaccine confidence is the trust that someone feels about the manufacturer that made the vaccine. They have the trust that someone feels towards the person who is administering the vaccine and the health system that they work in, and then the vaccine product that they are receiving. They want to know, is this safe and is it going to work? Many factors can influence vaccine decision-making, including cultural, social, and political factors, individual and group factors, and vaccine-specific factors or questions. So over the next few slides, I'm going to talk about ways that you can prepare your office and your community for the respiratory disease season. I will say that while many of the flu resources from HHS and CDC have not yet been published for the upcoming season, many of the messages and best practices from previous flu seasons still apply. So what we are waiting on are those handouts and flyers that we're all used to seeing from HHS and CDC. So some of the things that you can do to prepare your office are to go ahead and identify and organize patient reminder lists. So thinking about those patients who are going to go ahead and need the vaccines, the COVID-19, RSV, and flu vaccines, and pulling those lists together, as well as pulling together letter templates that you can use to send to your patients. You can be prepared to give anticipatory guidance for COVID-19 and RSV as recommended if vaccine supply is not available at the time that you're giving your flu or other vaccines. And then you can go ahead and make your clinic office a supportive space that welcomes vaccine questions and concerns from patients and parents. There are other proven strategies to go ahead and encourage parents and patients to stay up to date on vaccinations. You can also check out innovative strategies that are being piloted by IHS clinics across the country through the IHS E3 program. And then you can share up-to-date immunization recommendations, including schedules for patients, and display them on your website, or you can post them in your waiting room or communicate through your EHR messages if that is an option for you, or on social media. Another option for you as a healthcare provider is to go ahead and make a strong recommendation for the flu vaccine. We know that healthcare providers are still trusted resources for patients to receive medical information, including the flu and other vaccines. So the suggested formula that I have up here, I stole from the adolescent vaccination platform space. And what they recommend is the following formula. So say, give your because, followed by your strong recommendation, followed by the word today and why. So for example, you can try saying your because. So because Susie is 5 years old, give your strong recommendation. I strongly recommend that she get her yearly flu vaccine today to protect her from getting sick with influenza. Another example is because you have heart disease, I strongly recommend that you get your yearly flu vaccine today to reduce your chances of being hospitalized due to complications from the flu. Typically, what I've seen when I've been working in clinics is that patients will have follow-up questions, and that's okay. What I recommend is that you become familiar with ways in which you can answer those questions. There are various techniques such as motivational interviewing. There's something called the CASE method or the STRONG method. And learning about these multiple techniques adds to your communication toolbox. And then as you learn about these techniques, you can customize your recommendation based on your knowledge of your patient, their history of vaccines knowledge, their history of vaccine questions and attitudes. And so to wrap up with our vaccination key messages, they are as follows. And the first one is a yearly seasonal flu vaccine is the best way to help reduce the risk of getting flu and any of its potentially serious complications. The second one is that vaccination has been shown to have many benefits, including reducing the risk of flu illnesses, hospitalizations, and even the risk of flu-related death. And the third is that while some people who get a flu vaccine may still get sick with influenza, flu vaccination has been shown in several studies to reduce the severity of illness. And before I close out with the presentation, I want to take a moment to acknowledge burnout in the healthcare worker and clinic setting. So we know that the COVID-19 pandemic accelerated healthcare worker burnout. And we know that if burnout is not addressed, healthcare workers will continue to suffer and patients will not get the care that they need. I included a number of resources here that you can incorporate into your clinic, whether it's a vaccine-specific clinic or other clinic settings to mitigate burnout in your team. So the first resource is to learn to recognize the signs of distress and mental health challenges and burnout in yourself and your colleagues. The second is to stay connected and reach out for help. The third is to prioritize moments of joy and connection. The fourth is to get back to basics with good health habits. The five is to continue to use your voice to advocate for positive changes in your workplace or communities. And the sixth is to share resources among your team about burnout. And I bring this up because I want to acknowledge that we are asking a lot of our healthcare providers to roll out the routine flu vaccines as well as new vaccines this fall. And we are asking them to do additional work on top of the work that they've already done through the pandemic, while they may also be experiencing and healing from burnout. So I will go ahead and stop there. Thank you so much. And if we have time, I'm happy to answer some questions.
Thank you so much, Elise, for that wonderful presentation. That was really amazing and very informative. And there were some items that I wasn't even sure about and I really learned about. So thank you again. And now we're going to move to our question and answer portion of our call. So if you have any questions for Elise, please put it in the chat, or you can raise your hand on the raise hand item of the Zoom chat and we can answer your questions. We do have some questions that were asked previous before the presentation began. So I'll go ahead and ask those, Elise, and put those on there. The first question was, my pharmacist is against administering vaccines at the same time. What would you say to gain his support for administering both flu and COVID at the same time?
So I'm assuming this is within a clinical setting, so I will answer the question in that way. So you are more than welcome to provide this presentation to the pharmacist. I can also provide the recommendations, the link to the recommendation that ACIP has made about co-administration, and really, for me, emphasizing the importance of why we co-administer can be really influential in helping people understand the importance of co-administration. And the reason is so that patients are fully protected against the diseases that the vaccines are meant to protect against.
Thank you for that. And our next question that we had pop up was, what kind of strategies would be recommended for public health nurses to assist in covering patients with their vaccinations who do not seek primary care at IHS facilities?
That's a very good question. So I think public health nurses can play many roles in our healthcare setting. I think in my presentation, I talked about that strong recommendation, and I think public health nurses can play a role in providing that strong recommendation to their patients, even if they don't seek services at IHS. So if nurses have the ability to run patient lists through EMRs. I know sometimes that's not always an option, but if public health nurses can provide that educational piece, I think that can be a really key way in which they can influence the uptake of influenza and other vaccines.
Thank you for that. Our next question comes from in the chat box, which would be available through IHS for those 65 and older. I'm assuming which flu vaccinations would be available.
Yeah, that's an excellent question, and I'm sorry, I can't answer it at the moment. I know that our IHS formulary group met last week, and I believe the recommendations are going to be published, are going to be shared soon. So Dawn, what I can do is when that information becomes available, I can go ahead and share it with you. I'm sorry, I don't have it prepared today. And I'm sorry, if I can go back to answering the previous two questions, I'd also invite if anyone has anything else to add, to go ahead and include it in the chat. I'd be curious to hear what other people's thoughts are.
Yeah, definitely. If you have any comments you'd like to make on any of these questions being asked, please put it in the chat. We'd love to hear that. And we are going to be sharing the slides and the conversations on this next week. So you'll have access to this information too as well. One of the other questions was, so pregnant women in first and second trimesters can receive the vaccine?
The question is, pregnant women in first and second trimesters can receive the vaccine?
Yes.
The flu vaccine? Yes.
Okay, thank you. And then one question was thoughts on ways to communicate with those who are anti-vax or unsure of vax safety.
Oh, I wish I had a good answer for this. And I think that there are a few different strategies that can be employed. So I think the first thing to keep in mind that a no today is really just a not yet. That a no today might turn into a yes in a few months. And I think where healthcare providers can play a key role in this is providing that anticipatory guidance along with at least one takeaway. So what I mean by that is if a patient refuses flu vaccine, say, I understand. Here is a resource that I want you to read. And at our next clinic visit, we'll discuss your questions that you have about this. And I'll ask you again if you want to get your flu vaccine. And again, kind of going back to that strong recommendation, I think healthcare providers, in my experience, in my observations, healthcare providers kind of underestimate the influence that they have when making a vaccine recommendation. And again, kind of going back to that strong recommendation can go a long ways. I recognize that the information that I'm sharing right now is not a magic bullet, that there are going to be people who are just flat out refuse, and that's okay. I think as I shared before, I think the role that you can play as a clinician is really continuing to provide that education and that strong recommendation.
Thank you for that. Excuse me. And one question that popped up in the chat is there a tentative time frame for when sites will receive the flu vaccine this year?
Is there a tentative time frame for when sites will receive the flu vaccine this year? Sorry.
Yes, it says, is there a tentative time frame for when sites will receive the flu vaccine this year? I'm assuming like when, I guess, clinical sites.
Yeah, I'm sorry. I don't have that. Again, I don't have that information. I'm sorry. I will certainly reach out to our partners and ask that information. It is a good question. I apologize for not having that information prepared today.
Thank you for that. And we did have some comments on that in the chat box. We have, I think someone wants to clarify, only 38% of patients in IHS system received flu vaccinations last season. If so, strategies for increasing.
Yes, that's according to the data that we have. And I will say I double checked it with our surveillance team because I had a similar reaction. And strategies, I think those that we've talked about, I think preparing your clinics now for outreach and education, preparing your staff. And when I say preparing your staff, I mean everyone from the front desk person to the person who rooms the patient, to the nurse who takes the blood pressure and then even labs, have everybody be ready to talk about the importance of a flu vaccination for every patient that walks in the door. And then I think the other piece that is important to think through are the patients that we don't see in the flu season. So thinking about ways to do that outreach and communication to patients that maybe don't have, their yearly physical in September or October. How are we reaching out to those patients and encouraging them to come in to provide a flu vaccine? Again, I think we're in such a challenging yet such a wonderful time where we have an opportunity to roll out our full fall vaccine portfolio with flu, COVID, and for some patients RSV. I think that that we have an opportunity to do some really great work to prevent respiratory diseases. So those are the strategies that I've been thinking of around increasing flu vaccine uptake at our IHS sites.
Thank you. And then we had a couple of comments in our chat. One comment was, we must take in consideration some individuals have a fear of needles, and some will ask if they will ever be available in pill form.
I hear you on the some patients do have, I think there's a range of needle fear. Absolutely. I think some people, fear needles where it's like, okay, I'm scared of needles, but I'll get over it and do this thing. But for many people, needle fear is absolutely a real thing. And one of the pieces that healthcare providers can do is to walk patients through the steps that they will experience during vaccine administration, and kind of helping them understand what they can expect. So that is kind of my first part of the answer. The second part of the answer regarding pill form, I'm not aware of anything that's in the pipeline. Maybe others are aware, but I don't know. I don't know is the answer.
Thank you for answering that. And then we have another comment. This one's from Miss Sarah Clements. Thank you, Elise, just from a presentation by Harvard on communication around respiratory disease season. Some key takeaways were: 1, focus on people in the middle rather than the extremes. 2, safety is the main concern and reason for hesitating for COVID. 3, it is important to emphasize safety and explain how new vaccines, RSV, are building upon years of research. And 4, co-administration is great. Recommends suggesting flu first, then follow with COVID. 5, be wary of linking childhood RTI and COVID, given hesitation of parents around childhood COVID vaccines.
Hi, Sarah. Thank you so much for sharing those resources. I'm glad that that was a helpful presentation. Thank you for sharing.
And the floor is open. If anyone else has any additional questions, you can please put those in the chat. We also have some NIHB updates with our next webinars that are coming up that are posted here in the chat. So you can link on those, learn more, and register on each one of these links. Our next webinar will be Wednesday, August 23rd on crisis standard of care. And then our infectious disease grants will close this Friday, August 18th. So there's still time, a little bit time to apply, but please get your grants in for that. Also, the 2023 Tribal Infection Control Bootcamp is open. The registration is now open for that. So click the link in the chat and register for that. That will be held in Vancouver, Washington this year. Also, the Emergency Preparedness and Infectious Disease Institute is September 11th through 12th in Santa Fe, New Mexico at the Hilton Santa Fe Buffalo Thunder. And everybody please register for that. There are travel scholarships available, but on first come, first served basis. So make sure you register and apply for that as well. And we appreciate everyone for taking your time and interest in coming into our webinar today. Also, I will post again that we would really greatly appreciate an evaluation of today's webinar. This will be posted in the chat, so please fill please fill the evaluation out today or whenever you can, and that way lets us know that how we did on our webinar, and any information that we could use to help better our webinars for the next time around. Yeah, and so that information is now posted in the chat. And so if you have any questions, please let us know. And Alicia, you can go ahead and thank you everybody again for attending our webinar today on the flu vaccinations. And thank you, Miss Elise, for giving us that wonderful presentation. We appreciate your time. And again, thank you, each and every one of you. If you have any comments, please put them in the chat, and we'll be sure and try to email you or get back to you on your comments and questions. Thank you again for joining us today.